Ankyloglossia. This is going to be the $5 word for a common thing that we're going to talk about, tongue tie. Now, what is tongue tie? Well, tongue tie is where a frenulum, a flap of skin, attaches the bottom of the tongue to the floor of the mouth. Now, this can range from something that's very benign and thin to something that's so severe that the frenulum is thick and it sticks the bottom of your tongue to the floor and you're not able to move your tongue. This could present as problems at two times. One at birth with just being able to suck and swallow and cause pain to mom, especially if breastfeeding. Or later on in life, problems with speech. Now, decades ago, it was pretty routine for doctors to just go through the nursery and clip every tongue that they found. It was pretty common. It was found in about 4% of the population. This started falling out of favor for a couple reasons. One, the incidence of breastfeeding fell precipitously, and because of post-op complications. So when do we decide when to clip a tongue? Well, they're fairly common, and so your doctor should assess your baby when they first see them. They're going to look at how thick the frenulum is, how far it comes to the tip of the tongue. What kind of mobility does the tongue have? Can it get to the top of the mouth or to where the teeth are going to be? Nowadays, breastfeeding rates are going back up, and these frenectomies, or clipping of the tongue, are becoming a more common discussion. So when should it happen? Well, you should talk to your doctor first. There are some complications to having a frenectomy. Even though it's listed as a common procedure, and it is very easy to perform, there are some post-op complications. Post-op complications can include numbness to the tip of the tongue, post-operative infections, post-operative bleeding, a blood clot that forms in the bottom of the tongue, decreased feeding maybe for a couple days, and even the frenulum reattaching and scarring, making the condition worse. If this is recommended by somebody like a lactation consultant or a friend or a dentist, make sure you ask your pediatrician. It's our goal to first do no harm. If this procedure isn't going to be something that actually helps your baby, don't do it. So ask your pediatrician and we'll try and advise you as best we can. You know, it's not that easy to say. Go ahead and try it.